Hi, I'm Dr. Obermeyer, and the purpose of this video is to review shoulder pain as a cause of cervical or neck disorders. Shoulder pain is one of the most common reasons to visit an orthopedic surgeon or to solicit care for a painful condition affecting the shoulder. One of the more common causes of shoulder pain, believe it or not, is a source of pain that emanates from the cervical spine or the neck. This condition is referred to as cervical radiculopathy and is a common disorder that affects the cervical spine and specifically the nerve roots that emanate from the cervical spine, where they innervate or cause sensory disorders around the shoulder or arm. Failure to consider the possibility of referred pain, also known as cervical radiculopathy, is a common reason that patients may have ongoing symptoms of pain, difficulty with activities, and stiffness following a variety of different treatments, including procedures, interventions, and surgery, after a shoulder pain condition is not accurately diagnosed. Shoulder pain or arm pain that is caused by cervical radiculopathy is more common than one might expect. Sometimes symptoms from specifically the C5 or C6 dermatomes can cause symptoms in the front of the shoulder, the biceps, the forearm, and the thumb. And sometimes the symptoms are only at the shoulder itself or in the front of the arm. These symptoms commonly are caused by a pinched nerve in the cervical spine causing symptoms at this location. And it is important that a thorough screening exam be performed to ensure the symptoms are actually caused not by the shoulder in this case, but sometimes by a pinched nerve in the cervical spine. Symptoms from the shoulder itself commonly are at the anterior or front part of the arm and deltoid and frequently will be related to activity, are more insidious or slow growing in terms of their onset, and don't necessarily cause severe spikes of symptoms that, for example, patients will report as 10 out of 10 or cause them to present to the emergency room with severe and uncontrollable symptoms. These types of very severe symptoms are more commonly sourced by the cervical spine, and it is important that these conditions be considered. Pain that is more so located at the top of the shoulder, at the back or posterior arm, radiating beyond the elbow, or symptoms affecting the shoulder blade, between the shoulder blades, or at the armpit can commonly be linked with symptoms emanating from the cervical spine. Diagnostic tests that are utilized to differentiate the shoulder itself as a cause of pain symptoms versus the cervical spine are sometimes limited and not entirely sensitive to pick up the underlying cause of the pain. Specifically, things like X-rays and MRI commonly have more age-related wear and tear type changes that do not always correlate with clinical symptoms. And it is important that this context be applied in the decision as to whether to proceed with advanced imaging for evaluation of a pain condition. What can also confuse the diagnostic scenario is where there are age-related changes at both the cervical spine as well as in the shoulder. And that's why looking very specifically at some of the nerve roots that emanate at the cervical spine, specifically the C5 and C6 nerve roots as they emanate from the cervical spine as a cause of shoulder pain, should be very carefully evaluated. There are other more nerve and electrophysiologic studies, including something called an EMG, where needles are placed in the arm to help to differentiate symptoms as it relates to a pinched nerve. This test is sometimes not entirely sensitive to pick up strictly pain problems, but is more useful when patients have more severe nerve injury, for example, when the arm is getting weak. Other diagnostic tools include response to treatments or other interventions, including guided injections to different places in the body. For example, if the rotator cuff or the shoulder is a postulated source of pain, diagnostic injection with a numbing agent, typically consisting of a local anesthetic and a corticosteroid, can be administered to the area that is suggested to be the cause of pain. If this injection helps the symptoms, then the diagnosis is somewhat confirmed as the patient responded with a numbing agent applied to the area of pain source. Conversely, if a diagnostic injection is performed of an area that is suspected to be the source of pain, but the injection does not help, even temporarily, there is another cause of the pain, commonly from a referred source, which frequently is seen at the cervical spine. And in a similar fashion, diagnostic injections can be performed of the cervical spine, where selective nerve roots in the cervical spine that could be the cause of shoulder pain have medications administered around them so that those nerve roots are effectively numbed and sensory signals are limited from that area affecting the arm. In these cases, if the pain is improved, the diagnosis of a cervical source of shoulder pain is confirmed. Having diagnostic tests is very useful. However, sometimes simple physical examination findings can also be very helpful to help to elucidate the source of pain symptoms. Specifically, evaluating the cervical spine for things like the Sperling test, which helps to confirm that if there is a source of pain emanating from the cervical spine, rotating the head in a position that pinches the cervical spine and, in fact, the nerve roots that cause pain in the arm would reproduce symptoms. And importantly, a very careful evaluation of the shoulder helps to understand whether or not common sources of shoulder pain are present on physical examination. One of the more important evaluations is of the rotator cuff, where the strength of rotator cuff testing, commonly to external rotation of the arm, helps to determine whether or not there's any significant injury to the rotator cuff, particularly if symptoms are very advanced and the pain is quite severe. Other findings of so-called impingement of the shoulder or of the rotator cuff can be performed with the arm in provocative positions away from the body, so help to understand as to whether or not the rotator cuff is a source of pain, even if the tendon is not significantly torn. If you have ongoing symptoms or considering revision or secondary procedures, make an appointment today to ensure that your problem is accurately diagnosed and that your treatment is going to in fact help your condition. Thank you for your interest in this video, and please visit our website for more information.